Good afternoon. County Executive Rich Fitzgerald here. Give Danielle a second to put her mask over there. With our weekly briefing with Health Department Director Dr. Deborah Bogan. As we come to the end of the month, July has been a very, very challenging month. As we began this in mid-March, we saw most of the tests, in fact every month, the amount of positive tests in Allegheny County were under 1,000. We were close to 1,000 in June, and in July already we've hit close to 5,000. So it just goes to show some of the things that happened when we went into the green in early June, and things opened up maybe a little too quickly and a little too, people weren't wearing their masks, weren't socially distancing, things like that, and some of the efforts that Dr. Bogan and her team have taken over the last month have started to see flattening of the curve and actually some of the cases coming down again. One of the concerns you see though is obviously hospitalizations, particularly acute hospitalizations and fatalities. So we do worry that August may see a reduction in the amount of tests, but the lagging indicators that we talk about are of concern, and Dr. Bogan will certainly talk about that. But we want to make sure people continue to be vigilant, wearing your mask, socially distancing. Dr. Bogan can talk about some of the things that we're starting to see with backyard parties and house parties, and people again seeing what the contact tracing and case investigators are showing us. So we still have a long way to go. We're making great progress, but as we head into the school year coming up next month, both our universities and our K through 12 schools, it's going to be challenging. So we've really got to be vigilant in some of the things that we do to get those numbers down. So with that, let me turn it over to Dr. Bogan, and she can update you on where we are. Dr. Bogan.
Thank you, Rich. Good afternoon, and thank you for joining us again today. As you know, the Health Department follows a variety of metrics to assess how the COVID pandemic is affecting our community. Information I've watched closely this week is our hospitalization rate. Today we reported 10 new hospitalizations, yesterday 20, and over the last week we've reported 77 new hospitalizations in our daily reports. But these numbers really reflect admission dates from the last couple of weeks. We did expect the number of people hospitalized to increase when we saw the numbers of new cases going up, and we know again that hospitalizations lag by a couple of weeks our case counts. But our hospitals are prepared for it. We know that there are areas of the country like Texas, Florida, and California who are warning of hospital and ICU bed shortages, but we are not in that situation here. We flattened the curve at the beginning of the pandemic to give our hospitals time to prepare for an increase like we've seen in the past few weeks, and they are well prepared. I do get to talk often with our chief medical officers of the region's hospitals, and they have assured me that they have the capacity to handle this increase in hospitalizations and have robust plans to expand bed space if needed. The state has been providing data on hospital preparedness on its COVID-19 dashboard. The county data on its dashboard includes anyone in Allegheny County, the Allegheny County data on the Pennsylvania dashboard includes anyone in an Allegheny County hospital, regardless of the county they live in. The hospitalizations that we provide on our dashboard in our daily reports reflect only those who are county residents. The Health Department also continues to look closely at details provided by our case investigations. We are continuing to see an increase in people reporting attending private parties, and we're also hearing more cases about those attending weddings, funerals, religious services, gyms, or fitness centers. I urge you to practice COVID safety precautions like wearing masks, washing hands, and keeping at least 6 feet away from others, no matter what the event or wherever you're around other people. At weddings, funerals, or church services, avoid congregating inside and outside the building, and try not to hug or shake hands with others. But if you do, use your hand sanitizer before and after. And gyms should prioritize outdoor activities whenever possible. If you're exercising indoors, please remember you must wear your mask. Even in group fitness classes or on the bike, you have to wear your mask the entire time you're in the gym. And when you do wear your mask, please wear it over both your nose and your mouth. and make sure it's tight-fitting. The droplets that can spread the coronavirus that causes COVID-19 infection come from both your mouth and your nose. We have seen a decline in the number of new cases reporting going to bars and restaurants, although it is still the most commonly mentioned event that people report during case investigation. The data we collect through case investigation tells us where people who've tested positive have gone, but it doesn't tell us where people were infected with the virus. You can't be, you need to just remember to continue to keep bars, to be safe wherever you go. To continue to keep bars and restaurants safe in particular, about a week ago, we launched the COVID Field Response Team to address resident complaints made to our call center or online. The team goes out into the community, visits restaurants and other food establishments, checks their COVID safety precaution status, and provides feedback on how to keep people safe. The team evaluates to see if they are complying with indoor capacity, which is capped at 25% per the state order. If people are at tables are seated 6 feet apart, that any bar seating is closed, that the staff are wearing face masks and face coverings appropriately, that the staff are only serving people that are sitting at tables, that no smoking is allowed in even outdoor seating, and that the establishments are closed by 11 p.m. More information about the team, resources for bars and restaurants, and links to the completed reports is now available on the Health Department's COVID website under COVID Field Response Team tile. During the last week, the team visited about 350 establishments. They included bars, restaurants, ice cream shops, grocery stores that offer dining, convenience stores, etc. The good news is that 87% received an all satisfactory report and are highlighted in green on the list of completed checklists available through the COVID Field Response Team site. 13% had at least one item to address, and most of these places had only one item to address. The most common was staff not wearing face coverings, and the second was followed by too many people allowed indoors. Establishments that had at least one item that needed attention will have another visit from the team and a chance to have an all satisfactory report. The team's primary function is to educate establishments on how to keep their staff and customers safe. Many places the team went to this past week were appreciative of the visit and the information provided. Team members have reported back that the vast majority of bars and restaurants, big and small, are doing a great job following the safety measures. So thank you to the bars and restaurants. Thank you for caring about the health of your customers, your employees, and the health of our community. Staying safe from COVID-19 takes action from everyone. We all must wear our masks. If we're able, we must limit our trips out of the house and contact with others. We must use our hand sanitizer, wash our hands, keep our coughs and sneezes covered, and most importantly, stay home if you're feeling ill or if you've been asked to quarantine or isolate. So remember to stay safe and be kind. Thank you.
This first question is from WPXI. Can contact tracing be done effectively with testing delays of a week or more, and why or why not?
So contact tracing is best done sooner than later. The vast majority of our tests are still coming back within that window of 3 to 4 days, so we are able to do contact tracing effectively for those. The longer you get away from the test results, the less effective it is, which is why we've really been working with our labs to try to turn around tests more quickly. Because of the incubation period of the virus, the sooner you can tell people to stay home and quarantine, the better we are able to contain the viral spread in our community.
This next question is also from WPXI. The median age of new cases has risen from early 30s 2 weeks ago to early 50s this week. Is that increase concerning, and do you believe it's a sign of younger people spreading COVID to older relatives?
Yes, we certainly have seen an increase in the age. The median age is now up to around 45 for our cases, and it does reflect a decline in the percentage of cases that are between the ages of 25 and 59, which had been up around 50%. It's down around 32 or 33%. And we are seeing cases rise among our elderly and in our nursing homes. So again, yes, that causes me a lot of concern, and we're working very closely with our long-term care facilities and others to really pay attention to that very high-risk group.
This next question is from WTAE. There seems to be some confusion over the fall high school sports season. Who will ultimately determine if there will be a fall season of high school sports? Will the state health department issue an order? And does Allegheny County have the authority to relax or enhance the restrictions from the state?
So I'll answer the end first. So with all orders, we cannot at the county have more lax orders than the state does. We can have more stringent ones, but not more lax ones. As you know, the State Department of Health put out the guidance on sporting events, and we continue to work with them and will work with them around sporting issues. If it becomes an issue, of course, we could do that, but again, we're trying to work collaboratively with our schools and with our State Department of Health and State Department of Education on all of those issues.
This next question is from WPXI, and we actually had a similar question from two different reporters, so I'm going to throw them up in the air here. Dr. Levine said any decision on whether the Pirates can continue to play is in the hands of the Allegheny County Health Department. How closely are you monitoring the situation from over the weekend in Philadelphia, and what would need to happen for you to reconsider the safety of playing games in Pittsburgh?
Well, let me just say that the Pirates have been very good about communicating their plans with us and shared them with us, and they're very thorough and comprehensive. And they've really been a good team player with us. So any decisions we'd make, of course, would be taking safety of the players and the staff and everybody who works and our community in that decision, and we would work collaboratively to make that decision with both the state and with the Pirates. So again, I think they've been very attentive to safety issues and continue to suspect that they will do the same going forward.
This next question is from WTAE. As we head into the new school year with districts deciding on their own individual plans, what is the biggest concern when it comes to the overall health and safety of school children in the county?
So I will say that the decision about schools weighs heavily, I think, on all of us, because it's a really challenging decision. We really have to balance the risks of not sending children back to school. You know, school is a very important component of the lives of our children. That's where we have our children learn, they socialize, we have wonderful programming, and so that is a risk. And then there's, of course, the risk to balance of the actual spreading of the infection, both to children themselves, but also to their family members, to the teachers, to staff. And so it is an extremely challenging decision for everybody. And I know that the school districts have been working exceedingly hard, and we continue to have discussions with the health department, but all of the school districts, with the state, with us. So I'm concerned about all of those, and I think our numbers are continuing to come down, but our positivity rate is not below 5%. We hope it will continue to drop. It went from about 10 to 12%. We're down in the 7-8%. The lower the rate of transmission in our community, the easier it'll be to get children back to school. So again, I encourage you all to stay home if you don't need to be out, keep your masks on, and reduce our community spread so we can really make that decision about going back to school in the safest way we can.
This next question is from the Pittsburgh Business Times. When do you expect the field response team may begin re-inspections?
I don't have an answer for that right now. I'll have to check with them and see what their backlog is. They're trying to get out to we're mostly using a complaint-based system, so I'll see where they are on our list and when they're going around again.
And this final question from WPXI. Last week, Dr. Rachel Levine said the state has specific granular data but won't release it yet relating to the uptick in COVID-19 cases being tied to bars and restaurants. The owners of those bars and restaurants are demanding to see the data from both the state and the county. Is this something that the county would be releasing?
So we have released data starting at the Board of Health meeting. I provided numbers about the numbers of cases that reported going to bars and restaurants. We've reported that week by week for the last couple of weeks. And again, the numbers of bars and restaurants continue to be an order of magnitude higher than all of the other reported activities that people went to. And again, we will never release individual level case data because that is private, confidential, HIPAA-related data. We provide the summative data that we've reported out, and we'll continue to report out to you as we do our case investigations.
That was the final question. If there's any closing remarks.
Thank you, Dr. Bogan. And again, it's been a challenging month. It's good to see that the field response team getting out there, and that almost 90% of the food, the restaurants and the food, the ice cream places, the coffee shops, etc., have been very satisfactory in their response. So it seems like the cooperation level is very good for people to really continue to be cooperative. And that's so important if we're going to keep our economy and keep as many activities open as we can. We know construction and manufacturing and retail and office and R&D and all the things that we do to keep our economy moving. Even the restaurants on the restricted levels that they've been opened up by the state and working in conjunction with us. Obviously, seeing Major League Sports come back, and we'll be seeing where the PIAA and the WPIAL and local sports will go. But the Pirates being open and the Riverhounds have been playing a couple of games. The Penguins are going to begin, and the Steelers starting training camp. All of them have been very cooperative and very open about what they're doing and the plans and the mitigation practices that they have it. But we just never know how this will all go. We just got to continue to. Manager gets in an argument and he wears his mask and he stands. Ensure that they kept their social distance. For doing that. So school starts, and we really want to get those numbers down. If we and continue to listen to the advice